cardioprotective and does suppress the TSH, I think very quickly that observation from those studies, which should always be explained along with the fact that these were elderly, sedentary people, that there may be, if the heart is deconditioned, if the person's not doing cardioprotective nutrition, cardioprotective diet, cardioprotective exercise, the heart is more vulnerable to stimulation. You may get atrial fibrillation with coffee. You don't have to be frequent. But very quickly, especially in the U.S., these statements get distilled down. Whereas, for example, in women who've had Graves' disease or hyperthyroidism, once they become postmenopausal, there is a higher incidence of reduced bone mineral density in them. Very quickly, that finding, which should be stated with qualifications, becomes if you take thyroid hormone that suppresses your TSH, your bones are going to crumble under you and you'll fall to the floor. It's like gossip in small towns, and where I grew up in South Alabama and Mississippi, gossip gets distilled down to absurdly false statements that may have started out as very highly qualified findings in a particular situation. And I think that basically is what's happened. And of course there are, I just have to say it very bluntly, there are a lot of irresponsible endocrinologists who, even the bone mineral density thing is a settled issue. Suppressing the TSH does not cause reduced bone mineral density. We know that from studying thousands of thyroid cancer patients who all take TSH suppressive dosages of thyroid hormone. But still, endocrinologists are saying, well, studies don't really show that there's reduced bone mineral density, but you better be careful. You better not suppress your TSH. As though it's still true. They contradict themselves. It's a lecture. So,
yeah, very interesting. Yeah. So let's talk about with your treatment program. Now, I know we've mentioned the words, hypothyroidism and thyroid resistance, which, as you explain in your book, that really is the underlying cause of fibromyalgia. So they're not separate conditions. Is that correct?
Well, our precise scientific statement is that inadequate thyroid hormone regulation is the main underlying mechanism of most patients' fibromyalgia. There are a few other causes, and that's why we say the main underlying mechanism of most patients' fibromyalgia. And the inadequate thyroid hormone regulation comes either from hypothyroidism or thyroid hormone resistance. So you're correct. That is what we've said, and we like to emphasize the qualifiers because of what we were just talking about, the tendency of the media and people who have an agenda to take those statements and stretch them into something they can criticize.
Of course. Yeah, so with your treatment protocol, you term it a rehabilitation program, and you use a collaboration between the patient and the practitioner to obtain the best results. So how do you find that difference from a normal doctor-patient relationship?
We find that collaboration for us is just absolutely essential. And we find that most people are delighted when they have come from, over here we have managed care instead of socialized medicine. And it has some terrible limitations to it because physicians may be restricted to seeing a patient for only 7 minutes. And it's very difficult to establish rapport. And so we operate on a different basis. We don't deal with insurance or third-party payment at all. And that makes our services less available to people with more limited resources. But then on the other hand, we pack as much as we can onto our website, drlowe.com. We have almost 400 pages on it. And it's nowhere near as attractive as your beautiful website. Packed full of information. we like the aesthetic, but we packed in a load of information that
A lot of information, absolutely. Yep.
but for patients with more limited resources, we do everything we can to get information to them so they can use to get themselves well. Over here, patients can buy over-the-counter desiccated thyroid and treat themselves and don't need a doctor's approval. And we recommend to many patients who are hypothyroid. But for patients who do come in, we basically use the same protocol that we use in our clinical trials. We learn everything we can about the patient, do as many measurements as we can that are relevant to the person's metabolic status, and we create an individualized treatment program in collaboration with the patient. Not trying to shove various. A lot of patients can't take a lot of nutritional supplements in tablet or capsule form, and we try to help them find powders or liquids or whatever we have to do to work with that patient's individual needs. We do it, and we carry the patient through the treatment regimen as we originally formulated, and we remeasure, and it's fairly frequent intervals. And if we aren't getting a satisfactory response in terms of those measurements and in the patient's subjective changes that are taking place, improvement, then we reformulate and we modify the treatment regimen and try to tweak it so that it better meets that patient's individual needs. And when you had your accident with your leg, you may have gone through a similar process of physical rehabilitation, and where you work and with maybe a physiotherapist or some other practitioners, and usually with those physical rehab programs, they're individualized to that particular person, and we try to do this in working with people and helping people acquire what we call metabolic health.
Yeah, which makes a huge difference to people rather than the 7 minutes and a prescription and back out the door, or a referral to a more specialised practitioner like an endocrinologist, which is what happens in Australia quite often. And just as a point there, in Australia too, Armour thyroid is prescription only. And even then, a lot of doctors, of course, are very hesitant to prescribe it because they'll just prescribe Aroxine, which is the thyroxine in Australia. But for myself, when I was on that half dose of medication and getting really ill, I actually ordered Armour from the International Pharmacy online and had some Armour sent out to Australia. And that's how I started to get better before I was under the care of another doctor. So occasionally we can get it in from overseas when we're desperate for it. Yeah. So you talk about metabolism slowing factors that people need to change to get results. What are the most common factors that are slowing people's metabolism that they can change?
Well, there are a number of different, of course, two little thyroid hormone regulations and hypothyroidism and thyroid hormone resistance. Those are important factors to rule out or rule in and deal with. But there are also other factors. I have almost every patient do what I call a home glucose tolerance test. I have the patient get a glucometer, the same thing that diabetics use to regulate their blood sugar. And I don't send patients to the lab anymore because I don't want them swallowing 100 grams of pure glucose, because I don't feel like the blood pattern of blood sugar pattern changes that occur in response to that are really representative of what that person, what happens within that person when he or she eats carbohydrates at home or in a restaurant. So I have the patient use a glucometer to do the test at home, and we provide instructions, written instructions about how to do that. And it's really fascinating to me that I came up through the era when hypoglycemia was getting a lot of attention, low blood sugar. And for many years, I thought